Mr. Speaker, government spending on health care is undeniably crucial for the well-being of our nation. Tremendous progress has been made in reducing and managing the spread of HIV, TB, malaria, and other diseases. Indicators show that currently 97% of people living with HIV know their HIV status. 98.3% of people with a known HIV positive diagnosis receive antiretroviral therapy, and 98.4% of people receiving ARTs are virally suppressed. In addition, 64% of the clients initiated on ARTs have reported to have disclosed the HIV status to their family members, sexual partners, or other colleagues. Such gains are commendable and need to be sustained going forward. Mr. Speaker, TB accounts for nearly 1/3 of all AIDS-related deaths, making it a leading cause of mortality in people living with HIV. Hence, we should ensure that TB interventions are effective. It's encouraging that the TB treatment success rate currently stands at 84%, illustrating an improvement of about 4 percentage points from the figure last reported. Mr. Speaker, the nation cannot prosper if our children are not healthy and protected. At present, the national immunization coverage, as measured by the DPT-3 proxy indicator, is at 67%, and full immunization coverage is at 68%, according to the MR1 proxy indicator. In order to reduce mortality of those under 5 years old, our vaccination programs will continue to be supported. The human papillomavirus is the leading cause for cervical cancer in women and girls globally. To deal with this, the government took a policy decision to vaccinate girls between 9 and 14 years of age against this disease. Remarkable progress has been made as the vaccination rate is at 73.6% nationally. In the third quarter of 2024-25 financial year, a second dose of the same age group was introduced for immune-compromised girls. The plan is to extend immunization against HPV to ages 15 to 20 in 2025-2026. Mr. Speaker, we are now facing a relatively new phenomenon on the rise of non-communicable diseases, what we refer to as NCDs. This calls for the strengthening of prevention and health promotion programs and interventions, as well as the adoption of a healthy lifestyle by every Liswati. Significant progress is being made in repurposing the former TB hospital in Manzini to an NCD facility. A high dependency unit has been completed and preparations are ongoing to conduct the radiation oncology department, to construct that department, the nuclear medicine section. The high dependency unit is meant to cater for critically ill NCD patients, including those with cancer and those that have suffered from a stroke, amongst other complications. Tertiary health services in the country have been improved through the hiring of more medical specialists and commissioning of 2 new theatres in the new referral and emergency complex at the Mbabane Government Hospital. It is anticipated that the number of referred medical cases to neighbouring countries will decrease, thereby reducing the expenditure on the Palala Fund scheme. Government has been able to ensure that complicated medical cases continue to be transferred for treatment. There's also been an additional 12 ambulances to assist with the transfer of patients to healthcare facilities. To bring quality health services closer to the communities, the Hlatikulu Public Health Unit was structured and has been completed and commissioned. Rehabilitation of wards 4 and 5 at the National Psychiatric Hospital and renovations to the outpatient department at Lebombo Referral Hospital were also completed. The network of health facilities shall be improved through the completion and operationalization of Ndondozi, New Haven, and Induna Yitini clinics. Mr. Speaker, we acknowledge the challenges that we are all facing in the delivery of medicines to Yemaswati that are in dire need. Even though efforts have been made to correct this, these efforts still seem insufficient as there's still an outcry of the shortage of drugs. We plan to solve this persistent problem by transferring by transforming the central medical stores into a semi-autonomous entity. With assistance from the Global Fund, the government has engaged a consultant who is currently working on the logistics for the transformation. This will ensure that medicines are bought on time, at the right price, are correctly stored, are tracked from CMS all the way through to the patient, and it will heavily reduce the amount of medicines expiring. An allocation of 40 million emalangeni has been provided in this budget specifically for this transformation. Mr. Speaker, the 90 days pause of funding from US aid has caused a lot of stress in the system, and as we've become reliant on this funding. The US government's PEPFAR program has funded critical health staffing, systems, and health commodities for HIV treatment and prevention. Fortunately, the US government recently reinstated limited portions of its funding for urgent life-saving HIV care and treatment services. We continue to work closely with the US Embassy during this difficult time. In the medium term, the government will embark on the following priority areas: establishment of a National Public Health Institute to lead and coordinate essential public health functions. Sustain Eswatini's Prevention Center clinical research site. Rehabilitation of maternity theatres at Matanjeni, Nkuzweni, Nhlangano Health Center, and treatment plant for Dvogolwago Health Center. Operationalization of the neonatal intensive care unit at Nimbaban Government Hospital, and the construction of the radiation oncology department and nuclear medicine section. Government is allocating 3.1 billion emalangeni to the health sector to implement the above and other priority areas. Mr. Speaker, the Employment Bill, which seeks to repeal the Employment Act of 1980, was tabled in Parliament as Bill number 7 of 2023. Unfortunately, the 11th Parliament was dissolved before the completion of the legislative process. Cabinet has approved the bill, and we shall be tabling it to this August House soon. Mr. Speaker, the budget allocates an additional 55.3 million emalangeni to the scholarship program to cater for the additional intake of 1,000 students awarded study loans for the 2024-2025 academic year. This has raised the number up to 4,450 students for local institutions, including 80 students who will be studying outside the country to support the acquisition of science, technology, engineering, and mathematics, often referred to as STEM, rare skills, which are not offered in the country. Government has allocated a total of 702.35 million emalangeni for scholarships in the 2025-26 financial year. There are currently 18 regulated sectors of the economy and the same number of wages councils that are appointed by the Minister of Labour and Social Security. The wages councils are comprised of a tripartite, sorry, Mr. Speaker, I'm getting that in four times round, I've got a fourth time lucky. Tripartite, yeah. Structure whereby the government, employers, and workers each have 6 representatives to facilitate negotiations of wages and other minimum terms and conditions of service. The 18 wages councils have over the last 2 years managed to diligently carry out their work such that the percentage range of negotiated increases of the minimum wages for 2023 average between 4 and 20% and between 5 and 20% in 2024. This has resulted that the average minimum wage has increased by 8.8% annually for the past 2 years. With this increase being about double the inflation figures, we believe that it's going to reduce the percentage of inequality in Eswatini. Government will also construct 2 trade testing workshops, which will be used to test apprentices and artisans in the welding and plumbing fields. This will help clear the huge backlog of apprentices waiting to be grade tested, and in turn contributes to a reduction of youth unemployment. A budget has been provided of 821.76 million emalangeni to the Ministry of Labour and Social Security to execute its mandate. Mr. Speaker, The government of the King of Eswatini remains steadfast in ensuring that quality education remains accessible to all Yemaswati. Government has continued to employ teachers, especially those who have been on contracts for long periods of time, according to the needs in different schools. This has systematically been done using the Human Resource Information Management System, which uses identity numbers of employees. In the previous financial year, a total of 364 teachers were converted to permanent and pensionable positions. Mr. Speaker, following the ongoing pilot of the 4-year secondary program, the government will be introducing qualifications beyond EGCSE in 2026, wherein 4 out of 7 earmarked secondary schools will be offering A, S, and A levels. The rollout will follow a staggered approach, starting with 1 school in each region. These are Mhlume, Mhlatane, Manzini Nazarene, and Evelyn Baring High School. At Sibaya, the quality of education and other learning platforms were highly criticized for lacking relevance, exemplified by the increase in graduates' unemployment rates. To this end, the government has commissioned a high-level committee of experts to propose a transformation program for the education sector. The education transformation will ensure that the education system produces graduates that are skilled to make sustainable livelihoods for themselves and for others. Mr. Speaker, we are aware of the difficulties at UNESWA. The University of Eswatini continues to face a number of challenges despite the increase in subventions in the recent years. The challenges include poor financial management, non-remittance of medical aid and pensions payable for personnel, poor research output, and archaic academic programs, to mention a few. The state of affairs has led to numerous class boycotts and has greatly compromised the quality of education and the university's global rankings. In order to solve the UNESCO crisis permanently and ensure that the university gets back to its former glory, the government commissioned a task team to investigate the issues and come up with pragmatic recommendations. To this end, the task team has presented an interim report, and the government will commission a forensic audit while also implementing some of the short-term recommendations proposed by the task team interim report. Government is allocating 4.2 billion emalangeni to the recurrent budget and 316 million emalangeni to the capital budget to the Ministry of Education and Training. The government has increased the budget for school feeding by 33 million emalangeni. In addition, 194 million has been allocated for the OVC fund and 702.35 million emalangeni for scholarships, equaling a total of 5.41 billion emalangeni for the provision of education and training for all levels in the country. This represents a 16.6% of the total budget spent on educating Yemaswati. Mr. Speaker, government has continued to support the vulnerable populations through cash transfers to elderly persons and persons with disabilities. Currently, there are 84,740 elderly grant beneficiaries and 17,468 beneficiaries of grants for persons with disabilities, referred to as PWDs. In line with His Majesty's pronouncement, this financial year, government has allocated an additional 105 million emalangeni to cater for the increase in the elderly grant received by the elderly, which is a 20% increase, mainly to cushion the cost of living adjustments experienced throughout the economy, adding 100 emalangeni to the current 500 emalangeni monthly, bringing it up to 600 emalangeni per month. Government has also budgeted to increase the number of persons with disabilities receiving the national grant by 2,500 and adding 50 emalangeni to each recipient, raising the monthly amount received to 450 emalangeni. For the 2025-2026 financial year, the government of Eswatini will move all beneficiaries to the mobile money platform, referred to as MOMO, for grant payments to ensure efficiency and a cost reduction amounting to about 2.9 million emalangeni per annum. Following the submissions made during the Sibaya National Dialogue, the government, through the Deputy Prime Minister's office, has conducted a community outreach program in all 4 regions to identify vulnerabilities and other social ills that require immediate social protection interventions. Among the key deliverables to the poor and vulnerable population is the provision of a decent shelter. Through the support of partners in the current year, the government, through the DPM's office, has managed to construct 20 houses for the needy and vulnerable people, including elderly persons, persons with disabilities, and child-headed households. In the 2025 to 2026 financial year, government has made an allocation towards the construction of houses with backyard gardens, fencing, and water tanks to promote water harvesting in order for households to access clean and safe drinking water. Mr. Speaker, the government of Eswatini is committed to inclusiveness and mainstreaming of disability issues in both the public and private sector. Government has launched the National Disability Plan of Action from 2024 to 2028, which will guide the nation in implementing policies and development programs that are inclusive. The plan aims at promoting and protecting the fundamental rights and empowerment on socioeconomic issues for all persons with disabilities. In collaboration with the UN development partners, the government of the Kingdom of Eswatini received 13 million emalangeni to strengthen the services provided in the education and health sectors on human capital development of persons with disabilities. To deliver on the mandate for the PWDs, the government of Eswatini has provided the budget to establish the secretariat and ensure that the office delivers the aspirations of the PWDs as specified in the National Plan of Action. Mr. Speaker, the government has allocated 1.07 billion emalangeni to the Deputy Prime Minister's office in order to continue with these essential services of taking care of the most vulnerable. Mr. Speaker, agriculture remains the industry that could have can have the biggest positive impact on our economy in the short term. We have tens of thousands of hectares of unused terraced agriculture land in Eswatini, and we have a big unemployment problem. This is a recipe for a wonderful win-win if we could farm economically on small pieces of land. Many countries in the East have large percentages of their population successfully farming on small pieces of land economically. We have spoken about this many times over the years, but with food security being a focus area in the program of action, the Ministry of Agriculture is now starting a few projects to deal with this. One of them is a smallholder agriculture productivity and market enhancement project, what we refer to as SWAPEMP, which is scheduled to launch in May 2025 through the Eswatini Water and Agriculture Development Enterprise, EWADE. This project has a budget allocation of 60.4 million emalangeni. SWAPEMP aims to empower over 17,000 smallholder farmers, particularly in the vulnerable southeastern regions of the country. Mr. Speaker, the IDA funding referred to earlier will be used for another youth agriculture project. We have provided 50 million emalangeni in this year's budget for this project will be taking off soon. The government has allocated 65 million to the National Maize Corporation in the 2025-2026 financial year for the input subsidy and tractor hire program, which is designed to benefit smallholder farmers in the sector. A provision of 40 million emalangeni has been made in the budget for commercial maize farming, and 14 million to add to the Hambabuya project funding. An additional 10 million has been allocated to top up the Agriculture Development Fund. We would like to express our sincere gratitude to the Republic of China and Taiwan for its generous support in establishing the Aquaculture Research and Production Center in Malkerns. This initiative will significantly enhance fish production in Eswatini. The center will focus on developing innovative systems to increase productivity, producing fingerlings for distribution to fish farmers, and contributing to the eventual commercialization of fish production nationwide. The Republic of China and Taiwan has also given us a grant of 51.5 million emalangeni for building 2 more grain silos in Eswatini. The construction of the Mpangeni Dam, Phase 1A, is progressing as planned, and we are pleased to announce that the necessary financial resources for the main conveyance system, Phase 1B, has been secured from international financiers. The simultaneous implementation of both phases will ensure the efficient delivery of water to the targeted areas, with a dedicated budget allocation of 737.36 million emalangeni in the 2025-2026 financial year. This project will be a transformative force for the Shiselweni region. Furthermore, Phase 1B of the Mkonongwa Water Augmentation Project, MWAB, will commence in 2025-2026, focusing on the construction of the main conveyance system to facilitate the efficient distribution of water upon completion of the Mpageni Dam. This budget has also provided 46.5 million for the construction of medium and small dams around the country. The Lucid Phase 2 project remains a priority, with an additional budget of 230 million emalangeni. The project is currently in the process of installing in-field infrastructure, and its timely completion will be instrumental in delivering the anticipated benefits to our citizens. Mr. Speaker, livestock production continues to play a vital role in sustaining the livelihoods of our rural communities. Despite challenges posed by foot and mouth disease outbreaks in neighboring countries, Eswatini has successfully maintained its disease-free status. The government is actively working on the implementation of the Eswatini livestock value chain, which includes the rehabilitation of cordon fences funded by the European Union. A budget of 30.4 million has been provided for this. This initiative is crucial for the control and prevention of transboundary animal diseases, while also addressing concerns relating to stock theft. For the 2025-26 financial year, the government has allocated 1.65 billion emalangeni to the Ministry of Agriculture. Mr. Speaker, the government of Eswatini is on a strong drive to finance water and sanitation projects to support economic, health, and social developments aligned with the National Development Plan and the Sustainable Development Goals. These projects are central to the government's efforts to achieve 100% safe drinking water coverage across the country. The government has implemented the Eswatini Water Supply and Sanitation Project, estimated to cost 1.2 billion emalangeni in the Shiselweni region. This project will benefit 49,230 people with improved water supply and sanitation. The project is expected to be completed by the end of 2026. Furthermore, the Lomahasha Namacha Water Supply Project aims to provide clean water to 46,500 people by the end of 2025, benefiting communities in Lomahasha, which is in Eswatini, and Namacha, which is in Mozambique, and along the pipeline route, which is in Eswatini. Another major project is the Manzini Region Water and Sanitation Project, which is financed by the ADB. The cost of this project is estimated to be 1 billion emalangeni, and the objective of the project is to meet potable water requirements of Manzini and the surrounding areas, covering Mtongwaneni, Manzini South, Mhlambeni, Manzini North, and Mafutseni. The project is expected to benefit 110,000 people, and the expected date of completion is the end of 2025. This financial year, the Ministry of Natural Resources is partnering with World Vision to try to close the gap that still exists in the rural areas. We are grateful to that the World Vision has pledged a budget of 125 million emalangeni for the next 5 years to cover 15 tinkundla. The mining sector remains a subsector that has the potential to also significantly contribute to the economy. The multidisciplinary geoscience mapping project, the Airborne Electromagnetic, Radiomagnetic, and Magnetic Survey for the Shiselweni and Lebombo regions has been successfully completed, except for a few areas that seem to have some mineral potential, and these will be explored through ground truthing. These areas are Hlane Lomahasha and Lushikshini Tualile. A geological and mining information system and an electronic document management system has been successfully developed for the ease and improved geoscientific data and information dissemination to mining investors. Mr. Speaker, in the financial year 2024-2025, Eswatini made significant strides in its energy sector, achieving a number of key milestones. Notably, 2 hydroelectric power plants are advancing, the 10 megawatt Maguga and the 13.6 megawatt Lower Makuduza plants. These projects, combined with existing 60 megawatts of hydro plants, will bring Eswatini's total hydroelectric capacity to 83.6 megawatts by 2027. The construction of the Maguga expansion project is set to run concurrently with the Lower Makuduza development, contributing to the country's growing renewable energy capacity. In addition to hydropower, the EEC conducted a preliminary study on the potential for geothermal power generation, followed by geoscientific studies at 3 sites, Lobamba Mbuchini, Mkoba, and Lobombo Plateau. Eswatini is also advancing in its efforts to increase local generation capacity through small-scale embedded generation projects, allowing small power producers to feed electricity back into the grid. This initiative, alongside the hydro and geothermal developments, underscores the country's commitment to achieving a net zero emissions and boosting its local generation capacity. Mr. Speaker, the Rural Electrification Program has continued to improve electricity access for communities, with 4,227 households electrified and 887 ready boards installed for households without electricity in the 2024-2025 financial year. On the transmission front, the construction of the Twaleni Stonehenge 132 kVA line is nearing completion, and it's expected to be operational in the first quarter of 2025. This line will strengthen the power supply of the capital city and northern Eswatini. The regional electricity landscape remains challenging due to the climate change conditions that have reduced power generation in neighboring countries, like Zambia. This, coupled with high demand and a heat wave, has driven up electricity tariffs across the region. While climate change remains a challenge, the volatility of the electricity market means that tariffs will continue to be uncertain. Despite these challenges, Eswatini's commitment to self-sufficiency in electricity generation remains central to its energy strategy, which will continue to drive the country towards a greater energy independence and sustainability in line with the program of action. Eswatini has also signed up with the Accelerating Sustainable and Clean Energy Access Transformation Program, referred to as ASCENT, which is driven by the World Bank, African Development Bank, and the Rockefeller Foundation, which seeks to fast-track access by connecting 300 million people to electricity across the continent. Through this program, we envisage to have 100% electricity coverage in Eswatini by 2030. We have budgeted 80 million emalangeni for this. The Ministry of Natural Resources has been allocated a total budget of 1.57 billion emalangeni to implement its programs. Mr. Speaker, the tourism sector has continued to display strong performance, indicated by a growing interest in traveling to Eswatini from regional and international markets. Intercontinental visits rose significantly by 11.8% to 853,000 visits in 2024, reflecting an increase of 90,000 compared to 2023. This highlights the destination's appeal and the success of targeted advertising initiatives aimed at drawing visitors from all around the world. In the 2024-2025 financial year, the government has planned to complete the ICC. Unfortunately, we have failed to do so, but due to a variation in the scope of works. This year, we're providing 600 million to finalize the project, an additional 30 million emalangeni to operationalize the ICC. The government continues to provide regulatory oversight to ensure that all major infrastructural and economic development projects are subjected to environmental and social impact assessment, and comprehensive mitigation plans are developed to minimize adverse environmental and socio-economic harm. Mr. Speaker, government continues to provide an effective set of policies and regulatory frameworks to provide for enhanced environmental and human health protection. A comprehensive radiation safety bill has been developed and awaiting Parliament approval, and will be implemented to facilitate protection of the environment and humans from the negative effects of radiation. The government issued environmental grants worth 2 million emalangeni to communities in all 4 regions of the country through the Eswatini Environmental Fund. Furthermore, the government collaborated with communities to construct a total of 108 cleanup campaigns to conduct the campaigns. The footprint of the Eswatini Environment Fund has spread to fund environmental projects in communities across all 4 regions of the country, which has included seed funding for novel projects such as the Eswatini Reptile Education Center at Eswatini. The climate continues to change at an alarming rate, with extremes becoming more frequent and more severe. In recent years, damage to infrastructure and negative impacts on agricultural production have been observed. The need to minimize the impact cannot be overstated. We need to be more vigilant in our road and bridge construction, how and where we build our buildings, how we secure our assets to the ground, and even what crops we plant to be able to better prepare for climate change. Mr. Speaker, the government continues to fulfill its mandate in providing an enabling environment and socioeconomic development by spearheading digital transformation, improving access to services, facilitating infrastructure developments, expanding connectivity, and keeping the nation informed, educated, and entertained. In the next 24 months, the government will endeavor to deliver the Government in Your Hand platform, integrating all government services into a one-stop online web portal. Self-service booths will be placed at Tinkundla centers, post offices, and public libraries. To deliver this platform, government has partnered with Google, a global tech leader, who will also capacitate the country's local developers from the Royal Science Technology Park, Eswatini Innovators Association, and the Independent Young Innovators, creating a thriving innovation ecosystem. In the past year, government developed 7 applications that will be onboarded to the Government in Your Hand platform for various ministries, aiding improved service delivery in business registrations, deeds registration, and agriculture services, to name a few. Mr. Speaker, the government has made significant investments in infrastructure development, which lays a solid foundation for seamless government services. In the current financial year, 48 Tinkundla centers, 5 border gates, 5 rural clinics, 5 rural schools, and other government service centers have been connected to free Wi-Fi. Government plans to connect all remaining Tinkundla centers and extend the service to post offices and public libraries. A massive countrywide fiber optic rollout has begun. As we build a nation to be an information society and knowledge economy, bridging the digital divide, the government has offered several digital training programs and opportunities for different sectors of government and the nation at large. The country signed an MOU with the United Arab Emirates in September 2024, which has already yielded a number of capacity building initiatives. These include the Digital School Training Initiative of 50 teachers. More training has been scheduled for the coming years, including a coding school for the entire country, seeking to empower 300,000 Yemaswati to learn coding in the next 2 years. This year will see us setting up various tech academies at RSTP with global leading brands such as Google, Amazon, and Eswatini UAE Academy. The corporate manual is playing a major role in rebranding, standardizing, and improving professionalism of the government. The government is branding its vehicles to ensure responsible use by government officials and reviving the email system to ensure government communication, improve trust and flexibility, amongst other benefits. There's a small correction, Your Honourable Speaker. In the actual printed document, we found a small mistake, unfortunately, last night. And that is that this budget provides actually 354.34 million emalangeni to the Ministry of ICT for the rollout of all these targeted programs. So we just made a mistake of about 20 million. Mr. Speaker, even though the government has completed some major road construction projects in the past 2 years, more remains to be done to ensure the country's road network is not an impediment to the country's development in all 4 regions. One major road that is officially opened in 2024 is the Nhlangano-Skunuza Road, the MR13, after facing disruptions during the initial implementation period. All year-round accessibility to the entire country especially rural areas, remains key. The government will continue to work towards the upgrading of several roads through various initiatives. The phased approach of upgrading some roads has brought significant changes to the Spotkosini-Mochane Road, which is the D78, and the Stegi-Tikuba Road, which is the D12. The Roads Authority Act of 2023 has set the tone for the establishment of the Roads Authority, a mechanism that is meant to improve the effectiveness of the country's road infrastructure maintenance. The government is on course to fully establish the entity. As of the 1st of March 2025, the Act has approved 40 cents to be added to the fuel price for it to be able to operate the Road Agency Fund, so that maintenance of national roads, regional and local road infrastructure can be better executed. Mr. Speaker, the government's building stock also remains another area that requires attention from a property point of view. The current state of this infrastructure is not appealing to all, neither the users nor property custodians. An all-inclusive approach has been adopted to address the issue of public buildings maintenance to preserve the integrity and value. Government has made a provision of 371.67 million for road maintenance and major rehabilitation. We have provided 636.12 million for the construction of roads. We provided 200 million for the surfacing of rural roads. We have provided 30 million emalangeni for micro projects to continue concreting roads in the rural areas. A total amount of 1.21 billion emalangeni has been provided in this budget for the road program. Mr. Speaker, the launch of the country's only commercial airliner is another milestone of the last 2 years, and it has the potential to grow into a regional carrier. The new routes to Durban, Cape Town and Harare continue to enhance regional connectivity, driving trade and tourism. In the reporting period, which is April 2024 to December 2024, passenger traffic increased by 34%, with 73,926 passengers compared to 56,281 in the same reporting period in the previous financial year, while cargo volumes grew by 25%. The recognition by the African Airlines Association is a reflection that the airline has made its mark in the aviation landscape in the sub-region. In 2024, Eswatini signed 4 bilateral trade service agreements to establish working relationships with other countries. This provides the national airline with the opportunity to start cooperating with airlines from these countries and possibly start new routes. Mr. Speaker, the Regional Development Fund, what referred to as RDF, has completed 53 projects, which consists of 10 income-generating projects and 43 infrastructure projects, benefiting 8,730 Yemaswati directly and creating 445 jobs. The reconstruction program of Bukanyeni, Osia, Timbisini, Ngutseni, and Somtomo Tinkundla commenced during the 2024-2025 financial year and is anticipated to be completed in the 2025-2026 financial year. In the 2025-26 financial year, the government will continue to allocate 177 million to the Rural Development Fund, RDF, with an additional 60 million emalangeni towards clearing of the outstanding requests from the constituencies. 282.66 million has been allocated to Micro Projects Community Development Fund, what referred to as CDF. Government has allocated an amount of 532.7 million to the Ministry of Tinkundla Administration Development in order to continue with rural development services and its decentralization mandate.